A shortage of doctors in Ontario, it's going to get worse. In Sault Ste. Marie, 10,000 people lost access to their family doctor last month in what the Ontario Medical Association says was a perfect storm of retirements and resignations. So now the association is warning the same thing could happen in many other parts of the province. Joining me with more on this is Dr. Anne-Marie Mediwake. Doctor, good to talk to you today.
It's my pleasure to be here.
So you're in Sault Ste. Marie right now. What are you hearing from healthcare professionals there?
Yeah, and I'm a family doctor myself. What we're hearing here and what I'm hearing across the province is we have a healthcare system in crisis. Too many people can't find a family doctor, and that's going to get worse unless decision makers act now to create a system that we can be proud of again in the future, and one where everyone's supported by a family doctor.
And this is not just a problem for Sault Ste. Marie. What happens if this spreads elsewhere in the province? Is that a probability or a possibility?
Absolutely. What we're seeing is people without a family doctor end up leaning on the emergency room as their front door into the healthcare system. It means that they miss important cancer screening and other preventions. They end up going to the hospital more often. They end up costing the health system more money and making it less sustainable in the long run. And they actually end up living shorter. There are studies that show that. And that's why it's so urgent that we find everybody a family doctor and finally make family practice sustainable as a career option for our medical students.
When we spoke with the mayor of Sault Ste. Marie last month on the show, he told us Ontario did invest nearly $3 million for a new outpatient clinic called the Access Care Clinic, basically designed as a stopgap measure to provide patients in the city with the services until new doctors could be recruited. What are your thoughts on that move?
Look, we need more than stopgaps. Our healthcare system is in crisis, and that's why we're asking decision makers to meet the moment and step up. Let's find everybody a family doctor. Let's support those practices with teams, and let's make sure that everyone can finally get the care they need. People are worried, people are suffering. Enough is enough, and we need to get our healthcare system back on track.
The Ontario College of Family Physicians says about a third of Ontarians will be without a family doctor by 2026. If the current trends continue. It's one thing if many doctors are retiring, but why can't we seem to recruit new doctors?
And it's not just retirements, it's leaving early or cutting back on practice. That's 60% of my colleagues are saying that they're leaving early or cutting back. A big part of that is the administrative burden of family practice. People, as doctors, are telling us that they're spending 19 hours a week on unnecessary paperwork, unnecessary administration. It's burning people out. It's driving us away from caring for patients. What we're calling on the province to do is let doctors focus on being doctors. Let's get that unnecessary paperwork and administration off our plates. Let's get back to the care, and that'll help free up capacity to care for patients.
Makes a lot of sense. Now, we reached out to Ontario's Ministry of Health for a response. They wrote this, I'm going to quote here. This year, 100% of Ontario's residency positions were filled through the Canadian Residency Matching Service, 76 more positions than the year before. This data, our investments, along with the fact that Ontario has one of the highest compensation for physicians across the country, shows that students want to become doctors in Ontario and that doctors want to practice in Ontario. When you hear that, doctor, how do you respond to that?
Look, I don't know if that holds a lot of ground for anyone who's interacted with the healthcare system or even tried to find a family doctor in the province of Ontario. We know people can't get the care they need. They can't find a family doctor. Our healthcare system is in crisis. We have a health and a physician workforce crisis, and we're asking the province and decision makers to step up and meet the moment.
What needs to happen right now?
Right now, let's commit to finding everyone a family doctor. Let's support those practices with teams that are sustainable long-term. Let's get that administrative burden off the plates of docs. Let's focus on the care. And let's work on hospital and emergency room overcrowding. Because hospitals and emergency rooms are overcrowded, a lot of the people who are really complex and really sick are ending up in our offices as family doctors, and that's not sustainable. We have the solutions, we can do it, and it's time for decision makers to step up, meet the moment, and get our healthcare system back on track.
I can certainly feel and hear the promise in your delivery of this information. Dr. Mediwake, thanks for your time.
It's my pleasure.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.